This morning we have Dr. Morgan Francis from Scottsdale Premier Counseling joining us live to talk about really how this is impacting our mental health, especially in kids who, even though they're not directly involved in all of this. Well, a lot of people are not directly involved in this, but it's still impacting them mentally. I guess what are you seeing with people, how this is impacting them?
Yes. So specifically with children have a hard time verbalizing what they are emotionally experiencing. So they will somaticize it, meaning we'll see headaches, stomach aches, not feeling good, confusion, trying to make sense of it. There's so much information out there and they don't have the ability to make sense of it. Neither do many adults for that matter.
Right.
And then of course we're seeing our teenagers who are, going through the peaceful protests or speaking up and getting a lot of information on their phones that is really overwhelming for them to make sense of. So all around and as a community level, we are seeing a heightened sense of anxiety, hypervigilance, confusion, and even intense anger.
So what is somebody, if you're a parent and you're seeing this with your kid, what are you even supposed to do?
I think ask questions. Where are you getting the information from? Who are you talking to? What are you seeing? I think getting really curious so that you can make a better judgment of how to respond. At the end of the day, we want to provide our children with assurance and safety as best we can. So creating those same schedules, helping them to fall asleep at night. I know a lot of us are really struggling with sleep disturbances during this time.
You're talking about anger. I mean, there's anger on both sides.
Yes.
It doesn't matter what side of the political spectrum that you're on. And it's like, well, where does that anger go?
Yeah.
And like, how do you even, I guess, deal with that?
So anger by definition is when there's a threat to our safety. So safety, that threat can either be a perceived or it can be a real threat. So it's important that we recognize that it's actually healthy for us to be angry. Where it becomes problematic is how it's managed. And so if we're seeing outbursts, temper tantrums, things that are more aggressive or violent, clearly that is not going to be effective or helpful. So when we're angry, we need to talk about it. We need to be able to have a voice and a support system around us. So that might be within our community, that might be with our pastor, that might be with a teacher or a trusted adult to be able to talk about these things.
You were talking before we came on secondary trauma as well.
Yes. So what I've noticed in my own private practice is that many of my clients are struggling with secondary trauma, meaning it doesn't happen to them firsthand, but they are around the outskirts of it. So it is affecting their ability to feel safe, the unpredictability, especially with the recent raids at Zips. I have many clients that were affected by that, both personally and professionally, and knowing how to actually conceptualize that this is happening in our neighborhoods and really being very taken off guard by coming into that. So for them, they're trying to make sense of it just like we all are, and it's affecting their level of concentration, their feelings of safety, their sleep, their ability to trust that this is going to come out peacefully in any way that we can.
How are parents supposed, I want to talk about the kids again, but how are parents supposed to deal with, obviously you've got kids from both sides now coming into the classrooms at a very young age giving their political opinion.
Yes.
Kind of shocking that didn't happen back in the day, but now that's happening. And so very, elementary school kids, I've heard going in there and they are very well attuned to what's going on now.
Yes, we have to give a lot of grace to our teachers that are able to navigate this because none of us are trained to know how to respond accordingly, and being able to create space and safety and, again, respect for opposing different sides of what we're seeing. And it is important that children are able to talk about it with their parents and also recognize that this may not be the best place, especially at an adolescent level, to bring it into school and to continue to get the support around it at their home.
What do you say to your kid though when they do come in? Because I've heard it before, they come in and it's just like, well, where did you hear that?
Yeah.
I mean, you don't want to tell them, well, that's wrong.
No.
Because it's just a different viewpoint.
Yeah, so one of the things we can say is that's interesting. It's okay for us to have different opposing views. It's okay for us to have a different experience because we all are different with different experiences. So I think it's okay to neutralize rather than coming in and being more opinionated and having a very end of the spectrum type of response to our children, and get, again, curious as to how they can cultivate what makes sense for them.
And of course, if you need help, reach out.
Yes, absolutely. Please reach out. Absolutely.
Yeah, there's help out there.
Yes.
Dr. Morgan Francis, I mean, we could just talk all day about this.
I know.
I really like that. Interesting. That's interesting.
That's interesting.
That'll diffuse it right there.